Aloha and welcome to another episode of Cancer Answers Talk Story. I'm your host Heather Riffet, and joining me today is another cancer survivor, Mari Galiher. She was diagnosed with leukemia at the age of 4, but now she has overcome cancer and she is a new mom, and she also works as a content marketing manager at the Bank of Hawaii. And we'll get to know more about her life after cancer. Mari, thank you so much for joining. It's a pleasure having you here on this podcast.
Thank you for having me.
Yeah. So, Mari, I want to ask you, when you look back in hindsight, you were diagnosed with cancer as a child. When did you and your family realize that you had cancer?
So it's kind of an interesting story. I think there were a number of different signs that different people in our family and a babysitter actually noticed. I was napping a lot more, and at that age, you're kind of napping quite a bit less, right? You're supposed to be more active, all of that. And I was bruising a lot more, which is very unusual, especially if you're not bumping into things. At one point, I think there was even a handprint on my arm from the babysitter, and we know, obviously, that wasn't in her demeanor at all to do anything like that, so it was very strange. At that point, we went to my pediatrician, who ran a bunch of tests, and she felt all signs, pointed to that diagnosis, and I was then transferred to Dr. Bob's care at Kapiolani, and I think he made the official diagnosis at that point, and I was 4 years old at the time.
Mm-hmm, mm-hmm. And what really, did you have like a good support system as a child? I mean, obviously you don't recall it now very vividly, but looking back when you hear it from your family members, so what was that experience like? Did you have a good support system at home to get you through cancer?
Sure. So I definitely had, my family is amazing. I think also the team at Kapiolani, as well as the team here at the Cancer Center who helped to put together all of that treatment protocol, we had a very strong support system. I'm not sure what else we could have had that would have been better than that. I think what also made our situation unique was being on the clinical trial that I was on. I wasn't in the hospital quite as much, so I was still able to go to school as regularly as possible in that situation. So I think it was 1 week out of every month I was in the hospital.
And you participated in a clinical trial like you were mentioning. So what really made you participate? Or maybe like the family took that decision for you, but like, why do you think it's important for people to participate in clinical trials, especially like you were a child cancer patient? So why do you think it was necessary?
So I think my parents really made that decision solely based on their belief in the Cancer Center here in Hawaii. They wanted to ensure that I was able to stay here in the States, stay at home, to be able to have that support system of our family being here. And I think they really believed in the work that the UH Cancer Center was doing. I think as both alumni of the university, my parents believed in the work that the university really puts forth and how they're able to support our communities. So that made it a really easy decision for my parents to opt in for the clinical trial. I think something that seems a scary fact to some people is, that's actually a myth, is that clinical trials are like, you become like the guinea pigs almost. Whereas my parents knew that wasn't true, right? You're getting the same medicine as you would in a normal treatment protocol, but there are kind of different methods of going about that in the clinical trial. So that's where my parents, I think, really felt it was the best option for us. And I'm glad they made that decision. I think if I had to make the decision for myself now, I would probably do the same thing.
Yeah, because I think your parents knew better because they had all the information about a clinical trial. Otherwise, they wouldn't have enrolled you as a child.
Exactly.
So that's good to know. So now, how is life after cancer for you? Now that you've finally overcome it, when you look back, the challenges that you've been through, now you have a newborn, a son. So how is life after cancer?
Sure. So I think it's been really interesting. So I think I'm still participating in a long-term study for the Cancer Center through Kapiolani as well. I go for annual checkups, and they do different tests and whatnot, as well as kind of evaluating where I'm at with my life. And they've obviously been tracking this for 25 years now. And I think for me, it feels really special in some ways that I have my own team of not just doctors and medical professionals looking out for me, but also advocates too, making sure that all things considered, that I'm physically well, as well as really setting myself up for success. I remember ever since I was a kid, I would be asked by whether it was Dr. Bob or the different doctors, like, how are you doing in school? How are you doing socially? How are all of these things going for you? And those questions obviously have changed and progressed throughout my life. And it's just been really nice for me, I think. Yeah.
And how has your experience as a child cancer survivor made you more protective of your own son?
Sure. So, as I kind of mentioned when we were just chit chatting earlier, there were a lot of complications with my son at birth, and while that was so scary, and it was probably the worst nightmare my husband and I could have imagined at the time for my son, I had so much faith in not just the medical staff that we had, but the medical community here in Hawaii to be able to take care of our son. Of course, I'm very proactive when I see, just little things going on with him. I'm always worried about that, but I feel like it's helped me to know that I have a really good team behind me.
Yeah, definitely. And we also have the Early Phase Clinical Research Center being developed, so that's going to be another big advantage for people in Hawaii to stay here and not go to the mainland.
That's wonderful.
Yeah. And very lastly, towards the end, what do you want the listeners to kind of like take away from your experience being a child cancer survivor? Because there are many like you out there. So what do you want them to know, their families to know, their parents to know? And also tying it with the clinical trials and why it's important for them to kind of like enroll them if it's benefiting their child's health.
Sure. I think the one thing, in a nutshell, as easily as I could say it, is I think it's definitely probably the worst thing you could imagine happening. But on the flip side of that, how incredible is it that we have these resources and this facility right here in our island home to be able to provide and care for our children and for the next generations to come, right?
Yeah.
And I think something that, whether you've been impacted by cancer, you're on your own, a family member, or even a friend, I think people in the local community would just be amazed to know what's going on here in Kaka'ako. I think it being a little bit away from the public eye, every day traffic, you don't see the facility, so you don't think of it. But every time I definitely think of the cancer center, I drive by Kaka'ako, especially in this area, I think of, wow, I don't think people understand the medical miracles and the groundbreaking research that's happening right here just down the road from us. So I would love for people to think about that, or listeners to even know that, and I think that's something maybe we take for granted, or maybe that people don't even know about.
Yeah. Mari, thank you so much for sharing your story. It deserves to be told like many others. So thank you so much for joining me.
Thank you for having me.
Yes. That is all for now, listeners. For more information and resources, visit the uhcancercenter.org, and I'll see you next time. Take care. Bye-bye.